Good evening, everyone. It's Wynn Brown on Thursday, May 7th for our Heywood Healthcare COVID-19 update. Also, it's Nursing Week and Hospital Week, and I'm going to talk about some of the things that happened today. Thank you for everything the community is doing to support our staff and the things that our staff are doing to support one another. It's just heartwarming to see all the great things that are happening around our community as we battle this pandemic and try to tamp it down to a moderate level so that we can keep doing what we're doing while we wait for more widespread testing. And obviously the vaccine in the future is something that we desperately are wishing for and hoping that that comes sooner rather than later. Let's start right off the bat with our testing. We have tested 2,882 patients. And we have a negative rate number of 2,339, 378 positive results, 32 indeterminate, and our rate has dropped down below the 14% mark to 13.8%. The state has trended down slightly as well to 21.2%. You know, my personal hope is that we can bring our positive rate below the 10% mark and leave that at a manageable level so that we can continue doing work we're doing and also begin to reopen services as we wait for that widespread testing and obviously the vaccine in the future and hopefully the near future versus the distant future. Looking statewide, there are 340,000 tests that have been collected with virus detected in 72,025. Worcester County, we are just below the 7,000 mark in cases at 6,992. Franklin County, just up a couple clicks to 278 cases. At Heywood Hospital, we have 2 patients who have tested positive on our Watkins 1 floor, no one in our ICU that is COVID positive, and we have 4 patients that are under investigation and we're waiting for them to rule in or rule out. So definitely a much more manageable number you've seen over this past week. In celebration of Hospital Nursing Week, what better gift than that is there, quite frankly. There's also a chart that's going to be included with this, a graph with this video and email, and you can see our average trend rate for COVID positive testing, and you can see, you know, we peaked in the middle of April and we have come down dramatically. So it's a nice actually bell-shaped curve, and then I expect it to have a long tail as we get to managing that at a level that we can sustain. A bunch of thank yous today. Kathy Graves from Gardner, who made our flag that we all signed, many masks and head covers, delivered Priscilla's chocolates to hand out to nurses today. So thank you for showing them that you care. J.K. Crossroads provided lunch for Athol Hospital today. Delicious pulled pork and mac and cheese meals. That's amazing comfort food on a day like today. The gift was made possible through the community who made contributions to the Heywood Meal Card Gift Fund at J.K. Crossroads. So thank you for that. Domino's Pizza delivered pizza to Heywood Hospital employees today as well. So that is delicious. So we've had really yummy food today because the community cares about us. So thank you. The Heywood ER sent an edible arrangement cookie platter and some flavored popcorn to the Athol ER today in honor of Hospital Week and Nurses Week. Thank you, Tina Duguay from Heywood ER for coordinating the gift with your sister ER in Athol. Appreciate that thoughtfulness. We have a bunch of raffles this week that we've been doing in celebration of the week as well. The first for the 6th of this month, Real Heroes Wear Scrub Shirts went to Aaron Dahl from Heywood and Dan Tyler from Athol. Heywood Strong Gift Bag went to Debbie Gakowski. And then today, Real Heroes Scrub Shirt went to Christina Michaud from Heywood and Kathy Chaffee from Athol. And the Heywood Strong Gift Bag or Strong Bag went to Susan Hermanson on our OB unit. So just some fun things that we've been doing this week in addition to meals and special touches we've been doing. So thank you for all you're doing today. And, you know, as I always say, when it's a great day, get outside. This is a perfect evening for a walk, socially distanced. Please keep those masks on if you cannot socially distance per the governor's order, and just by good habit and hand washing to make sure that we continue to tamp down the positive rate in our community. You're doing a fantastic job, but there is no rest for us on this one. We have to keep doing what we're doing or we're going to spike back up again and experience that pain. So let's all work together, especially during Hospital Week and Nursing Week, as we support each other on our journey to be one of the best community-owned health systems in America, everyone. Have a great evening.